will be showing how to perform skill number 24, which is assisted sit to stand pivot transfer from the bed to the wheelchair and back from the wheelchair to the bed. This skill is used on patients who are generally able to sit, stand, and bear weight on at least one lower extremity, but they need some assistance with this transfer due to paresis, paralysis, or maybe weakness in one or both lower extremities. Before starting the transfer, we need to prepare the environment, so make sure that the chair is placed parallel to the bed, that it's locked, and make sure that the footrests are either moved to the side or removed if they are removable. For wheelchair skills, you can refer to skill number 17. The patient needs to be seated at the edge of the bed, as shown in skill number 21, with their feet flat on the ground. They need to be stabilized, so you may either put the weight belt, gait belt on them, which I'm going to use, or you can also stabilize them by placing one hand on the patient's shoulder and the other hand on the patient's hip. Since the patient is not dependent in this skill, she is going to help herself raise by pushing off of the bed using her arms. And I'm going to help stabilize her by grasping onto her gait belt. Make sure to provide instructions to the patient so that they know what you are going to do. So Jen, we're going to transfer from the bed into the wheelchair. On the count of 3, you are going to lift yourself up. I'm going to be stabilizing you so you won't fall. And then we'll pivot and we'll sit in the wheelchair. Does that make sense? Okay. Okay, let's start. Ready? 1, 2, 3, and pivot, and sit. If the patient has a weaker lower extremity, you also want to stabilize their stronger lower extremity, which is the one that is going to be the weight-bearing one. So say if she had a stronger left lower extremity, I would stabilize it during transfer by placing my left foot on the medial side of her left foot, and I would place my knee kind of on the lateral side of her knee. Now stabilize it like that during the transfer. So I'm going to transfer the patient back to the bed, assuming that she has one weak lower extremity. So her left lower extremity is the weight-bearing one, and the right one is the weak one. And I'm going to need to stabilize the stronger one. So Jen, we are going to go back from the chair to the bed. You're going to help me by pushing off of the armrests of the wheelchair. And then you're going to do the same thing. Just stand, pivot, and sit back on the edge of the bed. Is that okay? Yeah? Okay. So let's do it. I'm going to stabilize your leg with mine. So 1, 2, 3, up, pivot, and if the patient is weak in general and requires a maximum assistance of 1 for this transfer, you can stabilize both their legs by placing your feet and knees on the lateral side of their feet and knees. Once the transfer is complete, make sure that the patient is seated comfortably. So if they're in a wheelchair, make sure to place their feet into the footrests, or if they're on the bed, make sure to help them scoot back if needed and place their feet